What up, y'all? Welcome back to File Notice Media. This is Core, bringing you the second video of the day, the science update video. Something that's growing to be way more better than movies. I guess my clickbait articles or my clickbait thumbnails work better to scare you with science than to know what shitty movies are coming out. But anyway, this is cool. I read it yesterday, and I normally don't film on the weekends unless it's a movie deal. And I was like, ooh, this is good. And then more and more articles kept coming out about it. It really caught fire. So I was like, this is for sure what I'm going to be talking about. So with no further ado, let's put that title on the screen. Deadly super fungus could be the beginning of a global epidemic. This is brought to you by Futurism.com, and it was published by Christine Hauser in Health and Medicine. Antifungal resistance. Bacteria's ability to develop antibiotic resistance is well known, but as it turns out, fungi were evolving to withstand modern medicine. Now, one such fungi is cropping up in hospitals across the globe and killing half the people who come in contact with it within 3 months. According to an alarming story by the New York Times, raised concerns about a new global epidemic. Now, I read ahead and read the whole New York Times piece. It's really, really good. It goes into great detail. I'm going to go ahead and put the link to both this article that I'm reading to you now, as well as a New York Times article, in the link in the description below, all the good stuff. And if you like those links in the description, then you'll totally like the video. Hit the like button and then notify yourself, subscribe, and notify yourself to know when I'm telling you more important things. I would really appreciate it. Global threat. C. auris can infect anyone, but people with compromised immune systems, such as the elderly, are the most likely to succumb to the fungus. Doctors only just discovered C. auris a decade ago in Japan, but since then it showed up on every continent except Antarctica, with almost 600 cases reported in the United States alone. It is a creature from the Black Lagoon, says Tom Schiller, head of the CDC's fungal branch, told the New York Times. It bubbles up and now it is everywhere. Persistent pathogens. Once C. auris turns up, getting rid of it is extremely difficult. According to the New York Times, the Centers of Disease Control claims that more than 90% of C. auris infections are resistant to at least one major antifungal drug, with 30% resistance to 2 or more. And some medical facilities had to go to such extreme lengths as tearing out their floor and ceiling tiles to completely remove traces of the fungi from a room. If you want more information on that, definitely go ahead and hit that New York Times article link when you're done with the video. It's insane. I'll give you a quick rundown. So someone came down with this fungal infection, and once they realized what it was, they quarantined him off in an intensive care unit. Unfortunately to say, this individual later succumbed to the fungi. But the whole cleanup operation of this room is insane. Now, this is, I hate to say that this is pretty cool, but I find it really interesting because this is like a good little percentage of some of the work that I used to do. And I'll tell you what, hospitals have some of the meanest cleaning agents you've ever come across in your life. I used to do like environmental compliance and regulatory enforcements, and part of that was like if there was a spill or anything like that, if there was anything with chemicals that were outside of where they're supposed to be, I normally go and give the department a hand and let them know information and kind of help them along with their process. And I mean, I've worked at explosive manufacturing plants. I contracted for the government for like 9 years almost. And that hospital had some of the meanest things I've ever seen. So my point that I'm trying to tell you is, if anything can go ahead and clean sweep a room, it's a hospital janitorial staff, like hands down. And so they were going through this room to try to clear out all this fungi, and it was everywhere. They were saying it was on the light switches, it was in the blinds, it was on the windows, it was on the mirrors, it was in the cabinets, it was even like up in the lights, like absolutely everything in this room that had this patient was completely contaminated. And it went so far that they had to tear out the ceiling tiles and the floor tiles to like clean out this room and give it a clean sweep. I mean, this is like, there's crazy stuff that happens in medicine, and there's really strands of things that are very, very withstanding. But I mean, I I haven't heard of many cases in my 3 years of working at a hospital that has ever had them have to like demo out a room to get this to go away. So it's crazy stuff. So that wraps up that article. It was very short, and the next article I'm going to hit on this is brought to you by Forbes. I like to keep track of them too and see what they're doing. So let me go ahead and put their little article up on the floor so I can give you as much information as I can. That first article is kind of like a clickbaity one since it's so darn short. So let's keep this going. So Forbes announced that C. auris, why this fungi is an emergency threat. And this article was brought to you by Bruce Lee, a contributor, and also in their healthcare department. Here is a computer illustration of the unicellular fungi yeast C. auris, which was first identified all the way back in 2009. There's nothing fun about this fungi that's at yeast. Aha, okay, maybe this was a mistake. C. auris did, and is continuing to spread in hospitals around the world. It can remain on people's skin and objects such as hospital furniture and equipment for quite a long time. Thus, it can be spread indirectly from patient to patient. It can invade your body and kill you if your immune system is weakened. It can be resistant to 3 major classes of antifungal drugs, leaving doctors with very few options to treat C. auris infections. Therefore, don't take lightly that the Center for Disease Control and Prevention has dubbed it a global emergency threat. And yeast in quotations. He's funny. He's a funny guy, if you couldn't tell already. At Yeast, get to know more about this yeast. Jesus Christ. To get a sense of how troublesome C. auris can be, take a look at a study published last year in the Journal of Emergency Infectious Diseases. This study reviewed 31 cases of C. auris infections that has occurred in the healthcare facilities in New York City from 2016 to 2018. All of the patients already had serious medical conditions prior to getting the infection and ranged from ages 21 all the way up to 96 years old. Nearly 45% of the patients, nearly half, 45% of the patients ended up dying within 3 months of being diagnosed with this infection. Nearly all, 98% of C. auris samples from 50 of the patients were resistant to fluconazole and commonly used antifungal drugs. Testing of different objects in the room revealed that C. auris in the environments of 15 to 20 healthcare facilities. So here's this picture. It's a petri dish with the yeast C. auris growing. So the photo was taken by Nicholas Amur, and then pictures by Getty Images. Thank you, Getty accredited. Typically, C. auris infections occur after the patient has been in a healthcare facility for several weeks. The most commonly reported infections have been in wounds, bloodstreams, and ears. Yuck. Doctors have found the fungus in people's urine and respiratory tracts, but it is unclear whether the fungus just hangs out in those places without causing any trouble. In case you're not really familiar with fungi, I mean, a lot of it will just kind of hold into the body and just live there and do its thing. Like there's a lot of fungi around, and a lot of them aren't going to like displace the host in any way. But this one is killing them. So it's in case you haven't realized, it's kind of bad. For now, if your immune system is strong, your chances of getting a life-threatening C. auris infection are very low. Risk goes up if you have chronic diseases like diabetes, or have had a recent surgery, recent antibiotic treatments, or a central venous catheter. However, as Sarah Connor said in The Terminator, the future is unknown. Who knows if one day C. auris will be a threat to healthy people as well. That's about half of this article. I'm gonna go ahead and stop it there. So yeah, man, so if you're not in the know, now you're in the know. We have a fungal infection that is just spreading all over the place. It's killing half the people that it's getting in contact to, if not half, dang near close. So make sure you're careful out there. Make sure you wash your hands every once in a while. You know, if you're going to a hospital, if you're visiting someone or unfortunately have to go there yourself, you know, make sure you take really good care of yourself while you're there. Ask them. They have tons of little hand packets that you can have the squeezies that shoot out the antibacterial sprays and stuff like that. I don't know if that'll help you too much with this whole fungi infection, but every steps that you can take to be careful, take them, right? And so this is crazy. Like, as I'm reading these, I'm thinking back, there's a video game, it's super good, it's remastered. Give me a second, I have it. It's The Last of Us. So, like, I'm like, man, this sounds like it's The Last of Us, except it doesn't turn you into a zombie. It kills you. It's a worldwide epidemic that's wiping out everybody. So it's big news. I don't want to say it's necessarily exciting news, but it's news you should probably be aware of. I mean, anytime the Center of Disease Control announces this is an emergency, we're worried about this, it might be something to keep you aware to. Anyhow, thank you very much. If you made it all the way to the end, I appreciate you for it. And please don't forget to like, subscribe, hit the notification right there, then hit the bell next to it when it pops up. That way you can actually get notified. I release videos multiple times a week, multiple videos on science and movies. Thank you so much. File Notice Media. Bye-bye.